We're going to skip ahead to chapter 14, where we're going to talk about psychological disorders. And often when we're talking about a disorder, it's pretty clear. And I think the take-home message from today's discussion is that it may not be as clear as we expect it is. So we're going to work our way through several cases. And I want you to think about them, maybe turn off your video in between, but think about what factors seem to influence how you're seeing, what is a disorder or not. So Sasha's very sad, frequently tearful 6 weeks after the death of her partner. Now, think about the time. Is 6 days different than 6 weeks or 6 months or years? Does it matter whether she's just tearful or if she's suicidal? We use the same word to talk about a coworker or a lover. Does it matter if it was a coworker rather than a lover who died? And what if she's experiencing these symptoms but hadn't experienced a stressor? So consider turning off your video right now and come back when you're ready. Angel sees a vision and hears voices during the party. Does it matter if she took a hallucinogen prior to the party? Or if the vision was part of a religious ceremony? What if she had been withdrawing socially, taking poor care of herself and displaying other odd behaviors? Again, turn off your video and maybe write a bit in response to this. BJ works 12-hour days, 6 to 7 days a week. Her recreation time is spent playing competitive sports with people with whom she's negotiating business deals. She drinks 3 martinis a night to relax and fall asleep. Does she have a problem? What do you see the problem as? Does it matter if she doesn't see it as a problem? Think about under what circumstances you would be identifying this as a problem. Isaac masturbates 6 or 7 times a day, the last time in the living room in front of his grandma. And he thinks about sexual imagery constantly. Does it make a difference how old he is, whether he's 5 or 18? And if so, why? Does it matter, how he's functioning intellectually? If so, why? Again, turn off your video, write, and we'll come back and talk more about this. So when we're thinking about identifying abnormal behavior, we generally pay attention to behavior, context, and our observers' values. So some kinds of behaviors we're more likely to see as problematic. Suicide, for example, right? And we're much more likely to see that as a problem than perhaps rocking in a rocking chair. Although it might matter whether or how long the person was rocking in the rocking chair and what that person was doing or not doing, or what the reason for killing himself or herself was. Is this person, significantly physically ill? Is this a protest against some sort of political problem? Or is this as a result of depression? So the context matters. And from our perspective, things like the time period, the kinds of stressors, the relationship, all of those things matter. But it also our values matter, and they influence what we see as a problem or not. So, for example, during World War II, kamikaze pilots who came back from a flight or from the war alive were seen as dishonorable. It was better to kill yourself than to come back alive, not having engaged in honorable behavior. So our values influence what we see as normal or not. You know, do we expect children to be very active or not? And, you know, so you might want to begin paying attention to your values and how they influence what's going on. So when we're identifying abnormal behavior, we're typically paying attention to deviance. How unusual is that behavior? You know, so hearing voices, seeing a vision in the midst of a party when there's no other explanation, we see as pretty deviant. Maybe seeing it in a particular religious context is not, you know, depending on what the values are and the beliefs of your religion. Often, but not always, we're seeing issues of personal distress. So, you know, many, you know, probably, certainly Sasha experienced a lot of distress. Maybe Isaac was or wasn't. And we, you know, we might have drawn different conclusions about BJ if BJ was not experiencing distress. To what degree is a behavior maladaptive? If Sasha's unable to go into work, if Sasha's unable to get out of bed, if Isaac's behavior is impacting his family, if BJ, you know, is so focused on work that she is not engaging in the things that keep her healthy, in each of those cases, we'd be thinking about maladaptiveness. Certainly suicide, you know, is maladaptive. But these are all on a continuum, and you may be pretty deviant, you know, on a dimension towards abnormal, and yet not experience a whole lot of personal distress. Or it may be very maladaptive without a lot of distress. But typically, we're sort of seeing these things go together. When we're thinking about what abnormal behavior is, we're not thinking about culturally normative responses. You know, so in certain religious groups, it is okay, it is normal to hear voices, to speak in tongues. So we're not going to be calling that a problem. And we're certainly not going to be calling it a problem if what the real problem is some sort of conflict between the individual and society. You know, so we tend to believe that political coercion in order to produce particular coercion about politically unpopular beliefs is problematic. This semester, I'm going to ask that you use person first thinking. So rather than talking about the person who's a depressive or a suicide or a schizophrenic, talk about them, you know, as a woman with depression or a man who is suicidal, mother with schizophrenia. And you might think about that as you're reading Kay Redfield Jamison's short piece that I've assigned. We're going to talk about it this way because people are more than symptoms, all have weaknesses and strengths, and can best be understood and helped by seeing both. And take care.